Welcome to AFMC TV. I'm Robin Ledbetter.
The goal of that is to maximize people's quality of life, right?
You want to make sure that your housing is affordable in your community.
We have to think about vaccines in a way that we haven't thought about them before.
I had a lot of the legislative adults who were very creative.
Down on the floor and play with their kids.
AFMC TV, thanks for watching and have a great day. Welcome to AFMC TV. I'm Robin Ledbetter. Thank you for joining us. Today I have with me Nicolle Fletcher. She's Executive Director of Ujima Maternity Network and a doula trainer. Nicolle, thanks so much for being here.
Thanks for having me.
So to begin, tell us about your work with Ujima and how you've been involved in training doulas across Arkansas.
Yeah, so with Ujima Maternity Network, our heart pulse is really to kind of train and support collective work and responsibility. So Ujima is a Swahili word, a Kwanzaa principle, and it means collective work and responsibility. So when we look at the maternal healthcare landscape, we see some holes. And so we see some holes, particularly with Black mothers. And so we're trying to be the solution to help with that. And part of that is training, but also adding culturally congruent care. So really having a strong emphasis on the BIPOC community, training doulas and providing service and support in their own communities. Also, additionally, providing resources and things of that nature. So the training aspect of it is like, man, there's so many women that are interested in wanting to impact maternal health care, but maybe don't know how to do it and are looking for pathways to kind of link in and be a part of the solution. So doula training is a big part of that.
And we're hearing about a new class of trained doulas entering the workforce and in partnerships with UAMS. Tell us about that.
Yeah, so Ujima has been training doulas for some time now, several years, in fact, and I've personally been training doulas since 2012. So like a long time. And now we've kind of merged and there's been some grant funding that has come through to basically expand doula services throughout the state of Arkansas. So we realized there's a huge benefit that ancillary support that doulas provide, basically non-medical support that doulas provide, has really allowed kind of transformation when it comes to maternal health care. So UAMS was like, hey, where's the trainers? Where can we bridge this gap? So they have provided the funding. And so these women are able to go through this and training with 3 different organizations, Ujima being one of them, DONA being another, and there's another one, Doula Institute, I believe, where they get breastfeeding training. So they're preparing for breastfeeding and doula services on both birth and postpartum. And it's all in partnership with UAMS where they're funding and we're doing the work of the training.
And this newest cohort has 14 from 14 counties.
Yes, 14 counties. There's 25 women that are participating from the 14 counties in this particular cohort. And so right now we're right in the middle of the 5-day intensive. So we do 2 5-day intensives, and then they have 12 months of mentorship to get their research paper in, their book reports, and to get all of their requirements fulfilled in the 12 months. This particular round is a little bit different. We learned a little bit with our last year pilot program. Initially, it was 6 months, but with the great number of people that participated, 6 months just wasn't enough time. So it was a very intensive training. Now we've moved it to 12 months.
And geographic distribution is so important. Why?
Yes. Well, part of it is, we're losing hospitals with labor and delivery facilities. And so we need just that extra support within the community. One of the issues that Arkansas is facing is the ruralness of the state, right? So families aren't getting access to quality care. So it's not that the doula takes place of quality care in that sense, but kind of reminds the client, hey, you actually should get to the doctor's office. This is an important issue. Let's go see your doctor. Additionally, partnering with community healthcare workers in the area to say, this service, this support, maybe they're helping with transportation and aligning up resources around. So it is really important when certain areas are basically dry.
From a systems perspective, what does it mean to expand the doula workforce, not just for families, but for the healthcare infrastructure?
I think for the healthcare infrastructure, expanding doulas creates more familiarity. So I think when you understand how something works or a role works, and then you get your hands in it and you're networking with it, it makes more sense to you. I think for a lot of Arkansans and a lot of providers within the system, they haven't had much exposure. So with the lack of exposure comes a lack of understanding. And when that exposure expands, then we have better understanding of what is actually happening and how this particular role can benefit and complement the other roles, such as the obstetrician, the labor and delivery nurse, the postpartum nurse, and even in the care of postpartum, where we see a lot of the maternal mortalities and the issues, they are able to tap into that. So we're filling in holes and not replacing.
And research shows that doula support is associated with lower rates of cesareans,
Correct.
sections, preterm births, even you mentioned postpartum depression.
Yeah.
And how do those outcomes really translate into real world impacts? I mean, what are you hoping to see?
Well, you know what? Arkansas has been in the news and on the charts for a lot of things, right? In maternal health care, we're in the news and on the charts, not for positive things, right? So we have been in the top 5, number 1, bottom, if you will, when it comes to maternal mortality. One of the things that's really encouraging to me, and has always been encouraging to me, is that there's a high percentage of these rates of mortality and morbidity that are preventable. And so incorporating doula support into that will allow some of those things. That's how it translates in real world. When we're thinking about what do we look for, survival, I've always said, is a very low bar. So we're looking for women not only to survive or have their hopes on survival. We're let's talk about thriving. What does it look like to thrive during the childbearing years? And that's when we're talking about hope. That's what we're looking at. And it does require the collaboration in order for that to happen.
And so let's talk about maternal health disparities, particularly for women of color in those in rural areas. How can a more culturally competent birth workforce help address those disparities?
Yeah, so when I see myself in you, my guard is let down. There's a trust that isn't even communicated. It's just a clear understanding. And I think that makes a difference. When you can see yourself or see providers that look like you believe that they care for you. You believe there's an understanding. And especially when we're talking about training in some of the different counties that we're talking about, where these people live in those communities. So they're a staple in the community. They're not a stranger, and your best interest is in mind. And we think about even language barriers, right? So we're talking about the BIPOC community, and if I'm Spanish speaking and that's my primary language, I can't even engage in my care. And so that's a big deal. And so when I see somebody that can represent me and take me places that I can't take myself because I just can't do that, that's a beautiful thing. And care just changes.
And you're seeing that in this cohort?
Absolutely. We saw it in the last cohort. We're seeing in this cohort and moving forward. So it's just one step at a time. We're making the impact and making the change.
So for the healthcare providers that are watching today, how does the role of the doula complement, not replace, the clinical care provided by OBGYNs, nurses, and primary care teams? Yeah,
I think if we're super duper honest with this, right? The capacity, I feel like our providers are overworked. They're overworked, they're under-resourced, and having that ancillary support that is non-medical, but that can meet those social emotional needs, the community things, it really does impact the way the woman's care is. So I would say for the provider, ask your patient, do they have a doula? There's the Doula Alliance that can also kind of bridge where there's doulas in all over the state. And we've got maps now where they can find different doulas that are local to them. And I think that is really important. It does not take away your role. They actually complement and support the information that you're providing to your patient. And that's a beautiful thing when we understand our roles. I'm big on ride in your lane. If we're on the freeway and you're in the fast lane, stay in the fast lane, and take your slow self, stay in the slow lane, right? So when you ride your own lane, there's harmony. When you cross over without a signal, or you get out of your lane or get out of your role, that's when we have problems. And there have been history of there being problems, but if we stay in our lane, it works really complementary.
So with more than 50 participants already enrolled across those 28 counties, I guess total, since the program's launched, what's next?
Man, what's next? So there's, we're working on Medicaid reimbursement. That has already been passed and locked in. So now it's just time to get it to actionable, right? So we're at the place of waiting for the action to take place, where doulas can now get reimbursed through third-party payer, which is Medicaid, and even private insurance. And that's a big deal. 60% of Arkansans that are pregnant are using pregnancy Medicaid. So that will be a big relief on the maternal health care field anyway. And so there will create access. So that's what's next, is creating access. And so I'm big on, we can train all the doulas in the world, but if they can't make a living wage, then we still have an issue, because they're going to have to do a 9 to 5. And then that prevents them from being on call when the client needs them. So there's that work. So now it's we train them, and now we're trying to get them to where they have a living wage.
If you could share one message with policymakers, healthcare leaders about investing in doulas as part of the maternal health solution, what would you say?
I'm going to turn to the camera. Can I do that? Yes. So if I were to say something to politicians and leaders, first I would say thank you. Because we have done some work. So the first thing I would say is thank you for your trust and your belief, and the opportunity to say, we're going to change the trajectory for maternal health care in Arkansas. And we're going to be known for improved, significant improvements. So we're going to be, instead of at the bottom, we're going to the top. And so I want to say thank you. That's the first thing. The second thing that I want to say is, it's going to require continued collaboration, continued group work, and understanding how these different players have an impact on the community and the work that's being done. So this grassroots work, we have to change from the come to this place to see me, to go see them, to meet people where they are. And that, I think, is going to be the biggest next step and next change. How can we create the go see me instead of come to me? Meaning, come to me as the provider. I'm going to you in your community where you are.
Well, thank you. Thank you for coming and giving us an update, sharing your insight into how doulas work, but also the incredible work that's happened just in the last year.
Yeah.
Thank you.
Thank you for having me.
And that's it for this episode of AFMC TV. Have a great day, and thanks for watching.